Hello, it's Dr. Melissa Birdsell here from Birdsell Chiropractic and Acupuncture Clinic in Moline, Illinois. I put together some fun videos to try to show you about what I do on a daily basis, the different treatments that I do, including chiropractic and acupuncture, and a little bit of education and history for you. So I hope you enjoy. All right, I'm going to give you a quick tour of the clinic. All right, here's the front door. Our patients check in with Danielle right here. And then we have a nice socially distanced waiting area. We also have a Stay Fit senior gym for people to come exercise or for people to do rehab exercises. Here are some of our treatment rooms. This is room number 2. Room number 5, room number 4, room number 3, here's our library of books and references and some models to educate patients with. Here's where we do examinations. So we got our blood pressure cuff, some more models to educate patients with, a nice small chair for our young patients. Let's see, some of our mini tools for checking out different issues. Here's our x-ray machine. And we go down through the hall. Keeps going and keeps going. Here's our acupuncture room. This is our mechanical traction table, brand new. And straight down the hall here, we got another acupuncture room, a water massage table, an extra adjusting table, and then here's where we do consultations. Then in through here, this is where I do DOT physicals on truck drivers. We got an extra adjusting table. And here's our insurance. So here's our adjusting table. You see it can be rolled out and rolled back in. This is for comfort of the low back or for my pregnant patients. This also is for my pregnant patients or for comfort of the thoracic spine. I can also make the headpiece go up or down depending on my patient. So here's a close-up of the table. It's covered with leather. We recover it about every 10 years or so. So you can see it's getting a little worn down, but we'll replace it soon. And then I'll demonstrate how it goes up and down. You can see that's a corkscrew. That shows that this table is very old. It's about 70 years old. And here she goes. Sounds like I always tell my patients it sounds like a garage door or a roller coaster. And then it's really helpful for getting my patients on and off the table, especially if they have a sore back. This is our drop adjusting table. So what makes this table special is it allows me to use the drop mechanism to assist in a low back adjustment, uses gravity to our advantage, and it also has a drop mechanism for the cervical spine or the neck, which allows me to give a very specific adjustment comfortably. So something we treat here at the clinic is called a subluxation. A lot of times we just call it a pinched nerve just for an easier way to explain it to patients, but the true name is a subluxation. So basically what happens in a subluxation is the joint will lock up, causing irritation on the nerve root. So the nerves, as we learned, will innervate different parts of the body. They go to all your organs, they go to all your muscles, they tell your body what to do, how to function. So if you have a pinched nerve in your back, your body's not able to function as well. So as chiropractors, what we do, we evaluate the spine, take x-rays if we think that's necessary, and then we also evaluate the spine on the chiropractic table and check for pinched nerves or subluxations. So how we find a subluxation is if there's an area where the muscle's tight, the spine's not moving, we go in and we do a very specific chiropractic adjustment in that area to get nerve irritation to decrease. Here's a quick demonstration of a chiropractic adjustment. This patient happens to be about 37 weeks pregnant, so I'm doing a couple extra checks on her pelvic region to make sure everything's balanced. This makes sure the baby has enough room to move around inside and not have any uterine constraint, and it also helps the mom feel less pain and hopefully have a really good birth experience. What I'm checking for is each segment of the spine to have motion, and if the motion is not there, then there is a subluxation there, which we talked about previously. So basically I'm just checking every single joint to make sure it's functioning for her. This is our digital x-ray system. Here's the main control area where we can control the different measurements for each x-ray. This is called the collimator. So this is what actually takes the x-ray. You can move it up or down depending on what area you're taking an x-ray of, back and forth. You use those little knobs right there to make the x-ray area bigger or smaller. And it goes onto what's called a bucky that holds the film or digital film that puts the x-ray back to the computer. This is my activator adjusting instrument. I use this on certain patients that prefer not a manual adjustment. This is a little dog that I like to use with my younger kids to kind of distract them. They can give the dog an adjustment. Her name is Mabel, after B.J. Palmer's wife, Mabel Palmer. She was also a chiropractor. Here's another one of our spines. As you can see, it is very old. We also perform acupuncture at our clinic. Acupuncture is a Chinese medicine tool that's been around for about 5,000 years. Here's some of our needles. We use all throwaway needles and we use alcohol in the areas that we are going to needle. The needles are different sizes depending on the area that they need to go in. And that's the sharps container that we throw them away. Here's our acupuncture man. This shows all the meridians that are used in Chinese medicine and in acupuncture. These are the points that we put needles in. So, go ahead and...
I'm David Birdsell. I'm a chiropractor. I graduated in 1975 from Palmer, and I really enjoy doing chiropractic work on patients because it gets such great results, and it works, and it helps people that don't normally get relief from other forms of health care.
What are your favorite things to treat as a chiropractor?
My favorite is low back pain and sciatica.
What's sciatica?
Sciatica is actually a pinched nerve in the lower back which causes pain, which often will travel down the leg.
Cool.
That seems to respond really well to chiropractic care. And also neck pain.